Bloodborne pathogens. Every business that employs or has contact with people carries some risk of being exposed to the hazards of bloodborne pathogens. OSHA has established a guideline to protect workers who, as a result of doing their job, could come in contact with blood or other potentially infectious material. Key definitions to understand are bloodborne pathogens, which are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV. Contaminated means the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. Contaminated sharps are any contaminated object that can penetrate the skin, including, but not limited to, needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Decontamination is the use of physical or chemical means to remove, inactivate, or destroy bloodborne pathogens on a surface or item to the point where they are no longer capable of transmitting infectious particles and the surface or item is rendered safe for handling, use, or disposal. Exposure incident is a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duties. HBV is the hepatitis B virus. HIV is the human immunodeficiency virus. Occupational exposure is the reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against a hazard. General work clothes such as uniforms, pants, shirts, or blouses are not intended to function as protection against a hazard and are not considered to be personal protective equipment. Universal precautions is an approach to infection control. According to the concept of universal precautions, all human blood and certain human body fluids are treated as if known to be infectious for HIV, HBV, and other bloodborne pathogens. Work practice controls are controls that reduce the likelihood of exposure by altering the manner in which a task is performed. Personal protective equipment for bloodborne pathogens. One way the employer can protect workers against exposure to bloodborne pathogens, such as hepatitis B virus, HBV, hepatitis C virus, HCV, and human immunodeficiency virus, HIV, is by providing and ensuring they use personal protective equipment, or PPE. Wearing appropriate PPE can significantly reduce risk, since it acts as a barrier against exposure. Employers are required to provide, clean, repair, and replace this equipment as needed, and at no cost to workers. Personal protective equipment may include gloves, gowns, laboratory coats, face shields or masks, eye protection, ear protection, respirators, and other protective gear. The PPE selected must be appropriate for the task. This means the level and type of protection must fit the expected exposure. For example, gloves may be the only PPE needed for a laboratory technician who is drawing blood. However, a pathologist conducting an autopsy would need much more protective clothing because of the different types of exposure, such as splashes and the increased amount of blood that is encountered. PPE must be readily accessible to workers and available in appropriate sizes. OSHA's definition of an occupational exposure: a reasonably anticipated skin, eye, mucous membrane, or skin puncture contact with blood, semen, vaginal secretions, cerebrospinal fluid, or amniotic fluid that may result from job performance of an employee's duties, such as needle sticks, human bites, cuts, and abrasions, blood contact, or other potentially infectious materials. Work practice controls. Never pick up items with your bare hands. Perform all procedures in such a way that cuts down on splashing and spraying of blood or body fluids. If your skin surface, eye, or mouth is splashed or splattered with blood or other body fluids, wash or flush these areas with water. Always wear appropriate personal protective items such as gloves, eye protection, etc. Avoid eating, drinking, applying cosmetics or lip balm, touching the mouth, nose, or eyes in work areas where exposure to infectious materials may occur. If exposure occurs, if you have any contact with the person's blood or body fluids, except blood or body fluid splashes on intact skin, you should immediately report it to your supervisor. He or she will need the following information: date and time of exposure, job duty or procedure being performed at the time of the incident, detailed description of the incident, including specific information such as which safety devices were being used, the amount and type of fluid, method of exposure, and extent and duration of contact, decontamination procedures used. It is vital that you report the exposure in order to receive medical attention and evaluation. This evaluation will be performed by a licensed physician or another appropriately trained and licensed healthcare professional.